about the prevention and the control of hepatitis C virus infection? Unfortunately, regarding the primary prevention, that means that I will prevent the disease before its occurrence. Unfortunately, and in contrary to hepatitis B virus infection, I have no effective vaccine till now. However, the trials are working to find an effective vaccine against hepatitis C virus. So, hepatitis C virus, no effective vaccine, and also no data shows that the immune globulin is effective in prevention of the disease after post-exposure, so as a post-exposure prophylaxis. So, unfortunately for hepatitis C, secondary prevention is much more important than primary prevention. And remember this phrase: secondary prevention play a more major role in controlling hepatitis C virus infection in any country as compared to primary prevention. Why? Because there is no effective vaccine, and the post-exposure prophylaxis using immune globulin shows no effect. So the primary prevention based mainly on precautions in blood banks and the precautions in the healthcare settings to prevent parentally transmitted disease. Okay, so the main primary preventive measures for hepatitis B is vaccination. The main primary preventive measures for hepatitis C is following protective measures against blood-borne infections and measures conducted in blood banks. Let us to revise these measures regarding the prevention, general measures or standardized precautions to prevent blood-borne infections, proper sterilization of any instruments used during as a surgical or a medical procedure, and disposable syringe or one-use syringe or needles might be used. Don't share needles. Enforce aseptic technique. If tattooing is carried out, be sure that the piercing equipment or the equipment used is sterile and it is preferred to be one use. Standard precautions. Avoid contact of non-intact skin with any blood or blood products. Avoid contact of the mucous membrane with any blood or blood products, like wearing eye goggles and wearing gloves or even double gloves. These are the standard precautions. Wash your hand and wear your gloves and be sure that it has no intact gloves. And also, after removing the gloves with dealing with certain infectious material, I have to destroy these gloves. So the gloves should be worn when handling potentially infectious material and must be destroyed after that. Proper handling of sharps, and we remembered in hepatitis C, handling of sharp means I dispose it in the safety container and avoid recapping and deal with caution. These are the general measures. So primary prevention of hepatitis C depend mainly on general measures for prevention of any blood-borne infections: HcV, hepatitis B, hepatitis D, hepatitis C. Also in blood banks, please reject donors with unscreened for hepatitis C virus infection except during emergency. So screening of the blood for hepatitis C is very important. Screening of the blood for hepatitis C is very important. Reject all donors who have a history of viral hepatitis or elevated liver enzymes. Reject drug addicts and use what is called paid donors during emergency only, and maintain surveillance of post-transfusion hepatitis till reaching the source of infection. So these are the measures conducted in blood banks before using this blood in transfusion for patients. So the precautions in blood banks and the precautions, standard precautions in healthcare settings to prevent blood-borne infections represent the main primary preventive measures against hepatitis C. But to listen in the other other hand, the secondary prevention in hepatitis C is much more important. We remember that secondary prevention means early discovery of the disease, proper treatment, and the tracing of contacts. This is the secondary prevention. Secondary prevention, it is screening for patients, So I have to ensure early diagnosis to receive proper treatment before complications. And this term means screening for early detection and the proper treatment. This is the first line of secondary prevention. Immunization with hepatitis A and B to prevent over-added infection or super-added infection, to increase burden on the liver and increase the probability of fulminant hepatitis or chronic liver disease. So be careful that the patient with hepatitis C should be sure that he received the immunization against hepatitis A and hepatitis B virus. It is important. Give him a healthy education for the proper care and the compliance with treatment. Give him counseling and health education about the proper care and the compliance with treatment, and also frequent follow-up for early detection of complications like hepatocellular carcinoma. So the secondary prevention play a major role in hepatitis C control in any country. It represents screening for new cases, proper follow-up for early detection of complications, health education and counseling for care and treatment, and also immunization with hepatitis A and B to prevent deterioration or decrease the risk of fulminant hepatitis. Regarding control of hepatitis C, control measures applied to cases. I have to report all diagnosed cases with hepatitis C to the local health authority. I have to deal with the contaminated articles or contaminated tools or contaminated instruments during the period of hospitalization of the patient with caution, and follow universal precautions or universal parenteral precautions to prevent exposure to blood and body fluids. Also continuous and concurrent as well as terminal disinfection of all equipments contaminated with blood or body fluids of these patients, and provide adequate treatment. We have a new era in the treatment of anti-hepatitis C virus treatment, so we have to be sure that the treatment for hepatitis C is very important to be received, and also disinfection after termination of isolation of the patient, as well as reporting to local health authority. This is about control of hepatitis C infection. As we remember that in Egypt we have an elimination program for hepatitis C virus infection. What about this elimination program? The word disease elimination means decrease the incidence of the disease to a level below which the disease represents no public health problem. What does this mean? I mean that the country should decide a very low level in the incidence and prevalence of the disease. At this level, hepatitis C represent no major health problem in this country. So if I reach with the infection rate of 1% or less, I reach what is called elimination of hepatitis C. Before the phase of elimination, we started with a phase of control, just to reach the infection rate with 2% by 2025, and a more ambitious goal is to reach the infection rate with less than 1% by 2030. This is called control of hepatitis C, and at this level we mean elimination of hepatitis C. So Egypt has an elimination program for hepatitis C. Its aim is to reach with the infection rate to less than 1% by 2030. This is hepatitis C virus elimination in Egypt. What are the strategies conducted in Egypt to achieve elimination of hepatitis C in Egypt? The strategy depends on decrease the number of new cases, decrease the incidence of the disease. Also, targeted screening for early detection of cases. Then, afford treatment at a low cost. Fourth is to provide a treatment in a mass approach to all infected and diagnosed patients. So the pillars or the strategies for elimination of hepatitis C, which means decrease the infection rate to less than 1% by 2030, the strategy is to decrease the incidence. How I can decrease the incidence of hepatitis C? We mentioned that the prevention is through blood safety and safety injection, as well as follow the infection control measures and increase awareness among population about the mode of transmission of hepatitis C. So how to decrease the incidence? Through increasing awareness of the population, infection control measures, early detection of cases, blood and injection safety. Also, I have to ensure that early detection of cases, and this might be conducted among families of patients, for example, screening programs for university students, and later in 2019, a mass screening for hepatitis C over a period of 3 months for the whole Egyptian population as a strategy, or 1 million health for the Egyptian population. This health program succeeded to screen the majority of Egyptian population for hepatitis C. So the screening is a secondary preventive tool aimed at early detection and provide proper treatment for cases. And in the past, it was conducted for families of hepatitis C patients and university students. Recently, mass screening over the whole population was conducted. And the country might provide the drug at a low cost, and this actually occurred in Egypt. They also, Egypt's success in reducing the cost of treatment has dramatically improved access to treatment by affording the treatment at a low cost for those with low socioeconomic class, succeeded in providing the treatment to a large number of the patients. Also provide mass treatment usually through It was conducted actually through a web-based online registration system for the patients and through which access to the treatment. So this is called the mass treatment through a web-based online registration system established in Egypt for hepatitis C virus. In this registration system, registry of all hepatitis C and be sure that they receive their treatment. This is the pillars for all the strategies for elimination of hepatitis C: decrease the incidence, afford the drug, conduct a screening program, and provide treatment at a mass approach. Also, Egypt, in addition to the strategies for elimination by the Ministry of Health and Population in Egypt, provides surveillance programs to detect viral hepatitis, not only in primary health facilities, but also extend to the antenatal care units during antenatal care of pregnant women, in prisons, in dialysis units, and among patients require frequent medical intervention due to the presence of certain problems. So surveillance of hepatitis C extend to the antenatal care units, to the prisons, to the dialysis unit, and the patients requiring frequent medical intervention. This regarding hepatitis C virus infection, prevention, control, and the strategies for elimination in Egypt, the program that actually running and succeeded to decrease the infection rate as well as increase the recovery rate because of introduction of the new drugs, effective drug at a low cost for all populations through the health insurance and using a mass treatment approach. Thank you very much. I hope the information are clear. Thank you very much.